What is AVM and how does it cause hemorrhagic stroke? Have you ever wondered how certain conditions in the body can lead to serious complications like strokes? One such condition is an arteriovenous malformation, often referred to as AVM. This abnormal tangle of blood vessels can significantly impact health, especially when combined with hypertension or high blood pressure. An arteriovenous malformation is a unique situation where arteries connect directly to veins without the usual capillaries in between. Typically, arteries carry oxygen-rich blood from the heart, while veins return blood back to the heart. The capillaries are essential because they slow down blood flow and allow for oxygen exchange. In the case of an AVM, this capillary network is absent, leading to rapid blood flow from arteries to veins. This rapid flow can create a dangerous situation. The veins are not built to handle the high pressure of arterial blood. As a result, the walls of these veins can become thin and weak. This abnormal pressure can cause the vessels to swell and even develop aneurysms, which are balloon-like bulges that can rupture. When an AVM ruptures, it can lead to bleeding in or around the brain, resulting in what is known as a hemorrhagic stroke. Now, let's connect this to hypertension. High blood pressure can make the situation worse. The fast-moving blood through the AVM can elevate local blood pressure within the affected vessels to levels that are unsafe. If a person has hypertension elsewhere in their body, it can put even more stress on these fragile vessels, increasing the likelihood of a rupture. Therefore, managing blood pressure is vital for anyone with an AVM to lower the risk of a hemorrhagic stroke. AVMs can develop in various locations within the brain or spinal cord. They can cause damage by reducing oxygen delivery to nearby tissues, leading to bleeding or compressing brain structures. The lack of oxygen can harm brain tissue, while bleeding from a ruptured AVM can trigger sudden neurological symptoms typical of a hemorrhagic stroke. Most AVMs are congenital, meaning individuals are born with them. However, some may develop later due to injury or genetic factors. They are quite rare, affecting about 1 in 100,000 people, and are often discovered between the ages of 20 and 40. Many people with AVMs may not show any symptoms until a rupture occurs, which can lead to a stroke and brain damage. In fact, nearly half of brain AVM cases present with hemorrhage as the initial symptom. In summary, an arteriovenous malformation can cause a hemorrhagic stroke by creating a direct, high-pressure connection between arteries and veins. This weakens the vessel walls and increases the risk of rupture and bleeding in the brain. Hypertension can further elevate this risk by raising overall blood pressure, making vessel rupture more likely. Therefore, controlling blood pressure is essential for preventing hemorrhagic strokes in individuals with AVMs.